Protopic ointment is used on the skin to treat a skin condition called eczema, atopic dermatitis, in patients who have not responded well to or should not use other eczema medications. Eczema is an allergic type condition that causes red, irritated, and itchy skin. The drug works by weakening the skin's defense immune system, thereby decreasing the allergic reaction and relieving the eczema. Protopic belongs to a class of drugs known as topical calcineurin inhibitors. This medication is not recommended if you have a history of a certain rare genetic disorder, Netherton syndrome. Also, this medication should not be used by anyone who has a weakened immune system. Indications. Protopic ointment is indicated in adults and adolescents. Treatment of moderate to severe atopic dermatitis in adults who are not adequately responsive to or are intolerant of conventional therapies such as topical corticosteroids. Treatment of moderate to severe atopic dermatitis for the prevention of flares and the prolongation of flare-free intervals in patients experiencing a high frequency of disease exacerbations, i.e. occurring 4 or more times per year, who have had an initial response to a maximum of 6 weeks treatment of twice daily protopic ointment. Lesions clear, almost cleared or mildly affected. How to use. Protopic treatment should be initiated by physicians with experience in the diagnosis and treatment of atopic dermatitis. Flare treatment. Protopic can be used for short-term and intermittent long-term treatment. Treatment should not be continuous on a long-term basis. Protopic treatment should begin at the first appearance of signs and symptoms. Each affected region of the skin should be treated with protopic until lesions are cleared, almost cleared, or mildly affected. Thereafter, patients are considered suitable for maintenance treatment. At the first signs of recurrence flares of the disease symptoms, treatment should be reinitiated. Adults and adolescents 16 years of age and above. Treatment should be started with Protopic 0.1% twice a day, and treatment should be continued until clearance of the lesion. If symptoms recur, twice daily treatment with Protopic 0.1% should be restarted. An attempt should be made to reduce the frequency of application or to use a lower strength Protopic 0.03% ointment if the clinical condition allows. Generally, improvement is seen within 1 week of starting treatment. If no signs of improvement are seen after 2 weeks of treatment, future treatment options should be considered. Maintenance treatment. Patients who are responding to up to 6 weeks treatment using Protopic ointment twice daily, lesions cleared, almost cleared, or mildly affected, are suitable for maintenance treatment. Adults and adolescents 16 years of age and above should use Protopic 0.1% ointment. Protopic ointment should be applied once a day, twice weekly, e.g. Monday and Thursday, to areas commonly affected by atopic dermatitis to prevent progression to flares. Between applications there should be 2 to 3 days without Protopic treatment. After 12 months treatment, a review of the patient's condition should be conducted by the physician, and a decision taken whether to continue maintenance treatment in the absence of safety data for maintenance treatment beyond 12 months. If signs of a flare occur, twice daily treatment should be reinitiated. Method of administration. Protopic ointment should be applied as a thin layer to affected or commonly affected areas of the skin. Protopic ointment may be used on any part of the body, including face, neck, and flexure areas, except on mucous membranes. Protopic ointment should not be applied under occlusion because this method of administration has not been studied in patients. Contraindications. Hypersensitivity to the active substance, macrolides in general, or to any of the excipients. Precautions. Protopic ointment should not be applied to lesions that are considered to be potentially malignant or premalignant. The development of any new change different from previous eczema within a treated area should be reviewed by the physician. Care should be exercised if applying Protopic to patients with extensive skin involvement over an extended period of time, especially in children. Protopic is extensively metabolized in the liver, and although blood concentrations are low following topical therapy, the ointment should be used as precautions in patients with hepatic failure. Side effects. Stinging, burning, soreness, or itching in the area of treated skin may occur during the first few days of treatment. Headache, acne, small red bumps on the skin, folliculitis, stomach upset, flu-like symptoms such as fever, chills, runny nose, sore throat, muscle aches, or increased sensitivity of the skin to hurt, cold, pain, touch may also occur. If any of these effects last or get worse, tell doctor or pharmacist promptly.